chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Or prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So hindi niya na nararamdaman na minatapakan pala siya. So probably yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so anong plano mo? Sabi ko, pacheck na natin yan. So, pinacheck namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang, marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga kasi kahit naglilinis kami ng paa tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11. Support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo ako binayaran So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya, na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo.
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titignan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa, malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin Kasi nararamdaman ko talaga na maganda. At Norma Yusuf, ay pukul ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Welcome to another enlightening episode of Simply Healed webinar.
This program is brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. I just first want to say thank you to those who joined our new wellness series called Simply Nature Answers yesterday. Please know that if you've been curious about how Simply Nature PPARS products can make a difference in your metabolic illness or even cancer journeys, SNA or Simply Nature Answers is also a perfect program for you. Just to recap on our last week's topic, last episode we discussed the role of Simply Nature PPARS in fighting tumors. Lots of questions were asked and most importantly, answered by our experts. And this week, discover how cancer and metabolic illness patients can benefit from using PPARS because tonight's interesting topic is entitled Enhancing Breast Cancer Treatment with Integrative Care. Integrative Care is revolutionizing breast cancer treatment by combining medical therapies with supportive approaches. Plays a vital role in this process by supporting the immune health and promoting overall care, enhances outcomes, and helps patients thrive during and after treatment. We extend our sincere gratitude to each and every one of you for tuning into this webinar, and we encourage you to share this online event to your friends and loved ones who may benefit from the insights shared here tonight. So without further ado, let's dive right in. Please note that we will be having a what we call AMA or Ask Me Anything portion later on, so please feel free to drop your questions on the comment section. Leading our discussions tonight, our distinguished health experts. First off, I'd like to introduce a successful entrepreneur who is also a seasoned international speaker on a wide range of topics from personal success to healthcare. He is the CEO of International and the PPARS expert from Singapore. Let's all welcome Mr. Shyan Lim. Good evening, Sir Shyan.
Good evening, Sheila, and thank you for all our viewers. I noticed today we straight off in the Facebook, there are already viewers who are asking specific questions. So don't worry, we'll go and answer your questions after this short discussion so that every week you learn something new before we go into our open forum where you can ask us any question. So without further ado, let me hand the time back to Sheila. I'll see you guys in just a few minutes together with Dr. Jansen. He's already locked in. So that's going to be exciting. Sheila, the floor is yours.
Thank you, Sir Shyan. That's right. Even as early as now, you can actually throw in your questions on the comment section. Now, on to our next health expert. It's an honor to present our esteemed speaker, a distinguished graduate of St. Luke's College of Medicine. Dr. Calalan is a diplomat of International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. Currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Please join me in welcoming Dr. Jansen Calalan. Let's all watch this.
Hi everyone, this is Dr. Jansen Calalan. I'm a lifestyle medicine physician practicing integrative oncology. Welcome to our webinar. Let's start the discussion. Doing these modalities are very important to screen for breast cancer, no? Because it's through these modalities that we can delineate if the breast tumor is benign or malignant, so that or the necessary steps afterward. The cheapest to do would be breast ultrasound and accurate in detecting breast cancer. Overall, on average, no, the overall accuracy is 80%. So when we're talking about accuracy, there are two kinds, no? So we have sensitivity and specificity. So when you go on the internet and search these terms, sensitivity means that this is the percentage wherein you get the true positives. Specificity is wherein you get the true negatives. Okay? So if you combine these two data together, you would get around 80% accuracy on average. This is also true for mammograms. So the difference between breast ultrasound and mammogram is for ultrasound, you use sound waves, so you don't have any radiation or whatsoever for breast ultrasound. For mammograms, you use X-rays. Now, imagine you do an X-ray on the chest. So this is a similar technique wherein you use X-rays to check on the breasts, to check for any masses, any malignancies. Now, the X-ray will superimpose one image on top of the other. So if the density of the breast is higher, then you would get a less accurate result. Okay? So that's the limitation of a mammogram. Even though we have this limitation, we have to correlate this with the clinical findings. So if you have a breast that is growing in size, and upon physical exam, it's quite hard, everything points to malignancy, you do these two modalities, it points to a more malignant characteristic, then you have to do a biopsy. Or if you can excise the tumor immediately, then that would be a better choice. No? For the other imaging modalities like your CT scans and your MRIs, these modalities are used to stage the patient. What stage does the patient belong to? Now, the staging is very important because this will determine the treatment. Now, for CT scans, we usually use this if the patient's diagnosis is already more or less established. So say, for example, you already have the biopsy, you want to know the actual size of the tumor, you want to know where it is located, what other organs are affected beside the tumor, so that you would know how to operate on the tumor. So that's one use. Another one is to, of course, delineation. Again, if the ultrasound in the mammogram is not accurate, the reading is equivocal, meaning you don't know if it is cancer or not, then you use a more high-tech imaging modality like your CT scan or MRI. For the advantage of CT scan is that it's quite fast. You just go in, a few minutes, you're done. You can use contrast with it. When you push a contrast medium on the patient, that contrast will go inside the tumor as well if it has blood supply. Now, for cancers, we know cancers, tumors that are malignant, they form their own blood supply. So if you inject a contrast to the patient, that contrast will go inside the tumor, and when you do the imaging, that contrast will be captured by the CT scan. So if it is inside the tumor, if the contrast is inside the tumor, then the tumor has a blood supply. So it points to a more malignant characteristic as well. Now, the accuracy of CT scans in detecting or in detecting cancers is around 90 plus, more than 90% actually. Some studies are showing it has an accuracy of 98% even. Okay? Yeah. And the last one is MRI. For MRIs, we seldomly use it for diagnosing breast cancer or staging for breast cancer because it's more costly than CT scan. It involves a longer imaging procedure. The accuracy doesn't differ much from CT scan. However, of course, CT scans have radiation exposure. MRIs don't. Yeah, so MRIs use magnets to rearrange your hydrogen molecules. That's where the image comes out from. Okay, so those are the differences between the imaging modalities. There are different types of breast cancer. One such type of breast cancer is hormone receptor positive breast cancer. So this means that this type of breast cancer has estrogen receptors. So if a breast cancer tumor has estrogen receptors, then its growth can be stimulated by estrogen. So the estrogen would be, of course, coming from the patient herself or from exogenous sources or environmental sources of estrogen, such as your food, exposure to endocrine disruptors in the environment. Now, this is quite important because you would know what medication to use. There are hormone therapy available to help treat this type of breast cancer. And when it comes to prevention, you would also be more careful in the things that you're using, personal care items that you're using, and the food that you're eating. So when it comes to environmental factors, especially when it comes to the diet, dairy products have estrogen, okay, because it's cow's milk. There's no way for a cow not to produce estrogen when the cow is pregnant. And milk is only produced when the cow is pregnant, okay? So the cow's estrogen would also be seeping into the milk. And there is no way for us to separate the estrogen, the cow's estrogen, from its milk. Okay? So if you are a cancer patient drinking milk, then that's bad news. Okay? Because you would be stimulating the growth of the breast cancer if it has estrogen receptors. When it comes to environmental toxins, such as endocrine disruptors, no? So these endocrine disruptors are present in a lot of the things that we're using, especially plastics, fragrances, parabens. No? So, these are mainly found in personal care items, cookware as well. So just have to be careful not to use plastics when it comes to cooking or when it comes to heating your food. Don't let any warm food touch plastics, no? Because the plastics, no, would generate microplastics that can be assimilated inside your body, and these are endocrine disruptors. When it comes to personal care items, there are a lot of personal care items nowadays that have fragrances. Why are fragrances? Why am I so demonizing? Why am I demonizing fragrances? It's because these fragrances, the manufacturers often use phthalates, no, as fragrances. Okay, phthalates are endocrine disruptors. So if it is an endocrine disruptors, meaning it disrupts the balance of your hormones. In a lot of studies, these endocrine disruptors mimic the function of estrogen. So if it mimics the function of estrogen, then it can also stimulate the growth of cancer, of breast cancer, no, hormone receptor positive cancers. So you have to be careful of this. Other environmental toxins would include non-stick pans as well, Teflon, that is carcinogenic. So the cookwares that you have to use would be stainless steel, cast iron, or ceramic. Be careful of ceramic because there are ceramic pans that have non-stick coating. Okay, so I guess the better choice would be stainless steel and cast iron. Obesity, smoking, and alcohol intake all increases your risk for breast cancer. So it increases the incidence rate of breast cancer in a population. For obesity, it increases it by about 20% to 60% increase. For smoking, it increases breast cancer risk by 10%. For alcoholic beverage drinking, it increases by about 15 to 20%. So these are the numbers. These numbers are on average.
Good evening once again, everyone, and thank you so much, Dr. Jansen, for that amazing discussion. I'm sure that you have learned so much from that discussion. We are now in the what we call AMA, or Ask Me Anything portion. But before I call on the experts that will answer our questions for tonight, I just want to greet our viewers for tonight, starting off with Ms. Minda Banela, Ms. Ami Lazaga, Helen Basalio Kamunayan from Baguio. Good evening po. Ms. Elena Antonio from Dagat-Dagatan, Caloocan. Magandang gabi po sa inyo. Ms. Ethel Manaloto, Noemi Veras, our avid viewers from Bicol. Wow. Marhay na gabi sa Indong Gavos. Yes. And also from Ms. Rose Ann Gomez Narte. Thank you so much for watching our webinar tonight. Now, of course, let's not keep you waiting. I can see a lot of questions are coming in as early as now. And to answer our questions in this modern world filled with noise from different health opinions, trust the ones from the experts. And I'd like to call them now to answer our questions. I'd like to call on Mr. Shyan Lim and, of course, Dr. Jansen Kalala. Good evening, Sir Shyan, and good evening, Doc.
Good evening, Doc. Good evening.
Hello. Good evening. Hi.
Doc, really good to see you. Yeah, just happy to see you. 2020 looks like it's shaping up to be a interesting year. So to all our viewers, and Doc, I love your new video. Looks nice with different angle cuts. A fresh new look. You look very fresh in the discussion. And I learned something today again from the discussion. I took notes. So, okay, Sheila, let's go.
All right. So for our first question coming from Ms. Minda Banela, if I have already done my PET scan and the results are okay, do I still need to take PPARS?
I need to know the case. I need to know the case. Okay, so if you underwent PET scan, depends also on the stage of the cancer. If it is if cancer is the case, no. Uh, my suggestion is just stay on PPARS for, I mean, 3 to 6 more months just to be sure. Then you can forgo. And of course, it's not just cancer that we can use PPARS for. No, it's also other metabolic issues. So if you have these cases, we can still use PPARS for this. So yeah, depends on the case. It depends on the case when we decide to continue or stop the PPARS. But definitely, if the PET CT scan result is normal, there's no residual tumor left, then that's very good. The patient would be a lot simpler. The patient would just be on some maintenance supplements or medication, and yeah, we can just we can be a little bit more relaxed when it comes to the management.
You know, this is a good opportunity for you to have a consult with Dr. Jansen. Maybe because his schedule is already full, that's why he didn't ask for a consult with you. All right. So yeah, as you can know, Dr. Jansen is actually a very hot, as in a very in-demand doctor. So please, if those of you who need to have a consult with him, quickly schedule one as the months go by. You know, as the activity goes back to normal after the holidays, Dr. Jansen's schedule really gets packed. But I just want to reiterate what Dr. Jansen says. PPARS is great for all the metabolic syndromes. So these are all the normal chronic diseases that we face, from diabetes, blood sugar, even to arthritis, joint pains, gout. All these are more inflammation oriented. So one thing is that you are continuing with the protocol for you to finish your fight against cancer strong, you know, rehabilitate your body as well as possible. And of course, it's an opportunity to deal with all these comorbidities, which are factors that in the first place encourage cancer to develop, right? So there you go.
All right. I actually saw a follow-up question from Miss Minda as well. I think she has undergone or underwent colon surgery, and she's asking how to soften bowel movements or stool.
Yeah, PPARS can do that. I have a lot of patients though who experience softer stool, better bowel movement with just taking the tablets. Just the tablets. Imagine. If your stool is still quite hard, then you can use cleansing. Plus, if you're really constipated, another option is to use probiotics in addition. So, me personally, I use probiotics for myself. No, so far it's the only thing that worked long term. Yeah. So case to case. So we have to do a little bit of a trial and error, but these are the things that we can do. Yeah.
So for this particular patient, you have the option, because I believe, Sheila, right? Our cleansing plus comes in as simple as 5 sachets.
That's right. It's actually very affordable as well, just for 700.
So you could get your probiotics, which is also good, and then you can see which one really works for you.
Yeah.
Right? Find the best fit for you.
Yes. Just a tip, okay? If the constipation is really bad, you need immediate relief, I would suggest the cleansing plus, because it's like magic.
It's like magic.
Once you take, tomorrow you go. Longer term solution, which PPARS and the probiotics will come in. Okay? Because cleansing plus is psyllium husk, no? Psyllium husk with a lot of berries, berries extract. That's how they made it. So with the psyllium husk, that would actually induce bowel movement because it's a stool bulker. It's for short-term solutions, immediate solutions. Longer term, you really we need the PPARS and the probiotics. Okay? Yeah.
All right. I just want to quickly share, because I've learned this from Doc Jansen, that when he talks to his patients, he kind of advised the patient to set aside a little amount of the mixed cleansing plus to observe what's happening in the liquid or in the fluid, and it really gets thicker and thicker. So you really have to drink it right away when after mixing that one. So there. Okay, so for our next question, interesting questions tonight, right? So next question coming from Ms. Rose and hemorrhoids. How to take PPARS tablet, or which PPAR form is the best for this one?
Okay. The hemorrhoids is a consequence of your constipation. So to address hemorrhoids, fix the constipation first.
Yeah.
Once the constipation is fixed, if the hemorrhoids is still there, then we need another solution. So we use medication first. Then if the medication still doesn't work, the surgery would come in next.
So as what Dr. Jansen said, for the solution for the constipation, PPAR tablets, probiotics, and cleansing plus for a quick, immediate, short-term relief. All right.
That's right. Thank you, Sir Sean. Thank you, Dr. Jansen. Next question coming from Ms. Amy Lazaga. According to my mammogram, it's BIRADS 5 with 1.2 cm size. What should I take?
Okay, let me just explain what BIRADS 5 is.
Yeah.
So, mammogram, it's basically X-ray of the breast. Okay, so the mammograms, we correlate that with ultrasound, breast ultrasound findings. So, the BIRADS category, BIRADS is a scoring system. Okay, so we use BIRADS scoring to know what the probability of a mass the probability of a mass being cancerous or not. Okay, so BIRAD scoring is from 0 to 6. 0 is inadequate testing, 1 is normal, 2 is benign findings, 3 you have probably benign findings, 4 is probably malignant, 5 is suspiciously malignant. Okay, and 6 is confirmed malignancy. Okay, so a BIRADS 5 category, I will worry about this already because more often than not, a BIRADS 5, a mass with a BIRADS 5 score, more usually is malignant or cancer. But to confirm, we have to do a biopsy. Now, if the question is what PPARS should I take, if the question is like that, I would assume that this is cancer already. I would recommend liquid immediately. Okay. Of course, it doesn't end there. Okay. Ultimately, the tumor has to be removed. So you have to go see a surgical onco. Better if it's a surgical onco. Have your surgical oncologist take a look at the breast mass and have it removed. Okay. If we strictly follow the guidelines, okay, the oncologist would do a biopsy first. Then, if the biopsy comes out as malignant, then that's the time that they go in and do the surgery. Okay. My personal take. Okay, so this is not in any medical guideline or medical literature at all. This is totally coming from my experience with my patients and my medical practice and my temperament. Okay. Meaning, my personality, okay, as an individual. As long as there is a tumor that is palpable, okay, meaning you can feel the tumor on the breast, I would have it removed altogether. Okay? Why? It's for my peace of mind. So I can sleep soundly at night. Okay? Yeah. Because there are stories that I have heard from my other patients wherein they had a breast mass. They were constantly monitoring the breast mass until such time that it turned out until such time that the BIRAD score went up. So that's the time that they went in, did the biopsy, and have the tumor removed. So my take on that, why would I wait for a mass to turn malignant before I move and cut it out? If I will cut it out, if I would have it cut out in the first place. So if there is a palpable mass and it's operable at the early stages, I would just have it removed altogether. pay the doctor as a pay for the procedure as an elective procedure. Okay. Yeah, I would. Yeah, so that's my personal take on it.
Doc, when
Okay.
you say
Yeah.
have it totally removed, are you saying the tumor totally removed or the whole breast totally removed?
Have the tumor totally removed.
Okay,
But
so
of
it's
course,
not
yeah,
necessarily a full mastectomy because
yes.
nowadays surgery is very precise. Because I think
Mhm.
when you said that, I'm also like, oh, the whole breast. Okay, so you meant the whole tumor.
Yes, the whole tumor. So you have to really discuss with your surgeon on how the surgery would have to be done. Okay, so ask if a lumpectomy would be enough. Would mastectomy be more sound? If a lumpectomy would be done, do you remove the tumor only without margin, or do we remove the tumor plus a bit of breast tissue? Meaning, it has to be removed with margin. So a bigger chunk of the breast tissue would have to be removed, no? And of course, a lot of women would have reservations regarding this because the appearance would not be proportion anymore. So if you are someone who is younger, you might be more conscious with the appearance, and breast reconstruction would have to be considered later on. So these are some considerations that would influence the decision to go for the surgery or not, no? But this is your personal choice, so you really have to discuss with a surgeon about this. So Dr. Jeannie Katapia would be the best choice for this.
So for those viewers, if you are in the Metro Manila area or in Bulacan, all right, Dr. Jimmy actually holds clinic in both Metro Manila and Bulacan. So he's a wonderful, wonderful doctor. Dr. Jansen works with him, and we've also had many of his patients often give amazing reports, just like Dr. Jansen's patients.
Dr. Jansen, I just have a very, very quick question. For women who has undergone mastectomy and they underwent also the cosmetic surgery to have a presentable front now, ability of recurrence or relapse or not at all?
The chances of recurrence or relapse is not dependent on having your breast reconstructed at all. It still depends on whether the tumor, if there was a tumor that was found, was malignant or not, and the stage, if it is malignant, the stage of the cancer, no, the breast cancer. But usually, well, I haven't encountered a patient yet who had breast cancer, then had it reconstructed, had her chest reconstructed. I haven't encountered one yet, to be honest. So um really can't answer straightforward unless I look into the medical literature and find out, the chances of recurrence for cancer patients who had breast reconstructive surgery. Yeah.
Thank you, Doc.
But
Thank you so much.
the breast reconstruction, I don't think it would influence the chances of recurrence at all.
Yeah, Doc, I think I would concur with you, especially since when recurrence happens, it metastasizes to other parts of the body. And the reconstructed breast doesn't bring in new cancer cells. So yeah. So I think, Sheila, you were asking basically for all the ladies, right?
Of course, yes.
So can they go forward with their reconstruction surgery? So I think the answer is from our personal opinions, nothing is stopping you to go ahead. Yeah, but of course, check with your surgeon.
Thank you, Sir Sean. Thank you, Dr. Jansen. All right. This question was thrown. Next question was thrown to us privately by our viewers, coming from Ms. Yves. Can PPARS help for those who want to conceive or be pregnant?
Oh, okay. This one I can share. First of all, personal experience. Straight on, the answer is yes. The reason is that for those who want to have children, there are a few school of thoughts, right? Number one, there are those who actually do preconception preparation. So it's not just prenatal, postnatal. It's not just prenatal. It's actually preconception. So they will, for example, take time 2 to 3 months out from their stressful jobs, change their environment, meet a doctor like Dr. Jansen to go have some lifestyle adjustments, all right, to improve the quality of their sperm for the guys and the quality of the eggs or the condition of the womb and everything for the ladies. This is even before conception, okay? Before you even do the act to conceive a baby. And does it have impact? Yes, I do have friends who had problem conceiving and actually took 6 months off work. They literally took a 6-month vacation. And then after that, they conceived with no other interventions, right? So I think our work lifestyle does have a big impact. So that's number one. So why did I bring this up? Because if we're talking about bringing your health back to an ideal condition, improving every aspect of your health, which then affects your fertility, then PPAR tablets is a great product to help you do that, to give you that nourishment as well. Now, if you start talking a more direct intervention, then I would share. I have a friend, I don't know what's the challenge with your conception, right? So, but I have a friend, she only has menses twice a year. Only menses twice a year. So you can imagine how difficult it is for her to be able to conceive. So what happened is that she took PPAR powders for, I think, 6 months. Her menstruation cycle became normal. And now she's a mother of 3 children. Before that, she was actually married for 10 years without being able to conceive. And her issue is really about not having even a regular menstrual cycle. So for her, she was on PPAR extract powder. So these are our experiences in terms of the concept is to actually bring your body into a more healthy condition, and that would also have an impact on your chances of conception. But Dr. Johnson, what's your experience and your take on this?
I think, well, I don't handle fertility cases, so I'm not really. I won't say I'm not really an expert on this, no. But I have some ideas on how it can improve fertility. So
Okay,
fertility issues usually involve hormonal imbalances, no, on the female. For males, it can be because of the quality of the sperm. The quality of the sperm can be influenced by metabolic problems, no? Metabolic syndrome, obesity, diabetes, high inflammation in the body. Okay. Now, for the females, no, since we're talking about pregnancy, um, if if there is hormonal imbalance, usually there is an underlying inflammatory issue, insulin resistance. Probably you might have PCOS as well. These things, no, or a very high amount of testosterone. Okay, so with these issues, how can PPARS help? No, so PPARS can help with detoxifying your body. Number one, reduction of inflammation. It can also contribute to the improvement in metabolic function. So reduce insulin resistance, no, in other words. So in this regard, PPARS can help with of the patient. But of course, no, since I'm not handling any cases, any fertility cases, I don't know how successful this would be. Okay. I think it will be better if there is a doctor of Simply Nature that can help us shed light on this, no? But yeah, that's my personal take.
Yeah, we will keep a lookout and keep you guys updated. Because Dr. Johnson, this fertility issue is it's a tremendous issue right now among countries in Asia. I mean, traditionally in Asia, we have very strong birth rates in our grandparents' times. Yeah, and it's just a very challenging thing both in Singapore and surprisingly, because when I first came to Philippines, many people have 3 or 4 children. In this current generation, but like doc, in your generation, that's already like if you have 3 or 4 children, it's not so common anymore. And I think it's very clear that the fertility rate is really being affected, which goes back to something that Dr. Jansen has always shared with us about the processed food, about all these chemicals. These are really affecting our hormones. So for those who really who having a family is important, it is important to build to adjust your lifestyle, right? To go and really be more attentive in the choices that you make. To many ways, even like choice of deodorants, and because I noticed something in Philippines, I think people bathe in perfume. So the good news is Filipino and Filipinas smell very nice, but wow, the amount of perfume that they use is really quite tremendous, and I'm sure all these has a big impact on your ability to conceive. So just take care about these things. Yeah.
Thank you. Very helpful. Thank you, Dr. Jansen. Thank you, Sir Shyan. For our next question, coming from Mr. Jhen. For my dad who has Parkinson's and prostate enlargement, which PPARS would be the best, and can PPARS really help?
Doc, can I share personal first?
Yes, yes, yes. Go ahead. Go ahead.
So, Doc, you can prepare your answer. Okay, this one personal. My father-in-law had Parkinson's. All right, so this is something we saw and we experienced. So since it's my father-in-law, I of course have access and am able to provide him with the liquid extract. Okay, so I'll speak from first-hand liquid extract experience. Number one, my father-in-law's Parkinson progressed slowly. So it was, and his total energy level and his responsiveness and everything was really good, to the point that the doctors were surprised, and it was good. Now he was literally on PPARS in the beginning every day. Well, again, it's my father-in-law, so yeah, I could definitely supply him with that. Then it became a regular thing. So after first few months, then it really became like 2 to 3 times a week, the liquid extract. So he really progressed well. In the end, the Parkinson's still got him, and he died in his sleep. All right. So, but to the very last day, my father-in-law could still move with assistance. But towards the end, it was getting a bit difficult. But yeah, so from our perspective, our family's personal experience, it helped with the quality of life. It definitely cannot cure Parkinson's. It can probably allow the disease to progress at a rate which, and then in a manner which the patient seems to have a better quality of life. So that's my own personal experience. Maybe from the mechanisms of action, Dr. Jansen, your feedback and comment. Yeah.
Yeah. How would I decide which PPARS protocol to use on patient who has Parkinson's and prostate enlargement? So for prostate enlargement, first and foremost, there would be some degree of metabolic issue there, no? For the Parkinson's, it's very important how the patient is able. Does the patient able to swallow well? Because if the patient is not able to swallow well, then it's just the powder. The powder would be, we're left with the powder only. Yeah. If the patient is still able to swallow well, then I would have a choice between using, of course, the tablets is gonna be always there, but I would consider soft gel. Okay, the soft gel, though, to address the metabolic problem. So how often, what is the frequency of administration? I would start with one soft gel 3 times a day and see how the patient responds from there. No, so how long how long would I expect a significant impact or significant change? Between 1 to 3. I would see probably a hints of no. However, no. Here it is. I don't see patients who have Parkinson's, neurodegenerative diseases. I don't see these kinds of patients. So it would be similar to the fertility question a while ago. I think it would be best if we have a doctor
Right.
from an SNI doctor, no, who is very well versed in neurodegenerative diseases to comment on this. But just from a theoretical standpoint, we should get benefit from using PPARS, no? Because Parkinson's is also hinged on inflammation. But the main issue in Parkinson's is the lack of dopamine. Okay? It's a lack of dopamine. So the dopamine will influences the movement of the patient, especially movements which are intentional. Okay? So or intentional or voluntary, in other words. No, so if the condition of the patient has very high inflammation, it will worsen the Parkinson's. But if the patient's inflammation is quite low, you would see better functioning, in other words. No, so that's where the Parkinson's. For prostate enlargement, it's a mix. Inflammation is always there, okay, because prostatitis can enlarge the prostate. So if we use PPARS to lower the inflammation, it should address the swelling. But of course, we still have to look at hormonal issues, metabolic issues, especially insulin resistance. Obesity is also one. Then we have to address those as well to help improve the condition of the patient. No? But definitely, PPARS should be part of the protocol because at least we have to do some detoxifications. Heavy metals can also heavy metal toxicity can also produce these kinds of complications. So that's how I would approach the case. No, if I were to handle one.
So, many times when it comes to cases like that, I would also sometimes just highlight to patients that, even no matter what case, anytime a family member is ill, we are open to the very basic thing of, like, for example, supplementation. I would like to give my loved one multivitamins because they're fighting some illness, right? So from that perspective, the PPAR tablets is just like the better choice because it really deals with inflammation, and that's one of the root cause for all these brain disorders. But I want to thank the particular viewer for bringing up this question because, especially now in the beginning of the year, because in the business this year we've been focusing, working with a lot of oncologists and moving into the area of kidney failure, working with dialysis centers. But in my heart, I mean, if Dr. Jansen remembers, one of my concerns as a Singaporean is that one of the major issues we have in our nation, in my nation, is that the alarming number of senior citizens who are developing dementia, Parkinson's, Alzheimer's. So this is really particularly tough on the generation, my generation and the next generation, because many of us are only child. And that's very difficult. Imagine you're 30 plus, 40, or even maybe slightly younger, you're only child, and your parent develops one of these brain disorders. It's just going to be so hard. At least in the Philippines, if you have 4 other brothers and sisters, we can take turns to, support mom or dad, right? But in a single child family, if your parent has dementia or Alzheimer's, it's just going to be so difficult. It will really be a wrench in your life, in your whole family's life, including your wife and your children. So this is something, thank you for the reminder. We did work with neurologists like Dr. Alhambra. She's a very esteemed neurologist. She uses PPARS for one mechanism, as Dr. Jansen said, to manage the neural inflammation. It's not a cure, she uses PPAR protocol as a way to help the patient manage brain disorders. That means improve it to support the other protocols or even drugs that they need to use. Okay, so yeah, that's my input. But thank you for bringing this up. I'm reminded again, so I'm gonna start my engine and put some focus on this, because that's something, especially as we are also going to focus in our activities in Singapore. I would thank you for reminding me. I do have a personal interest in this particular area. So keep a lookout. We might have some updates for you later in the year.
Thank you, sir. Thank you, Doc Jansen. Actually, one question just raised up here, and I think you've answered yes to this question. The question is, my mom is diagnosed with vascular dementia. She is also diabetic and hypertensive. Can PPARS be used for her?
Yeah, the obvious
Yes.
answer is yes, for the diabetic hypertensive, and for dementia. Yeah.
Thank
I
you.
just want to ask this
Yes.
interesting question. Doc, why do they say that Alzheimer's is a form of diabetes?
Okay. Yeah, because with Alzheimer's, they also see insulin resistance, but the insulin resistance is mainly found in the brain. Yeah, so that's why they are touting it as also very a form of diabetes. So yeah, that's the simplest answer.
Okay, thank you very much.
But the main issue with Alzheimer's is because of these neurofibrillary tangles. No, these are proteins found inside the brain that disrupts the signals, the nerve signals, the electrical signals going to and from the nerve endings. It disturbs them, so the brain cannot make any meaningful interpretation of the signals. Okay, because of this. So think of it as noise. When we're say, for example, we're talking on a walkie-talkie, some tangles, okay, these proteins, think of them as noise. No, so the more proteins that disrupts the signal, message or the message that the nerve signals wants to convey would be blurred. Okay, so you would not know how to interpret it if at all you're able to send it out or to transmit it, if at all. Okay, in some cases the message or the nerve signals transmitted to one nerve and to another at all. Okay, so this leads to memory loss. You just cannot remember the event, or the idea. Yeah. Okay. So this is. I hope I made sense.
I think I think what we have done. I really want to thank the viewer is highlight something, because we're always talking about cancer, and the thing about cancer and dementia, Alzheimer's, Parkinson's, of stress on the other family members in supporting the patient. So for Ms. Rose, please, vascular dementia is really, the root cause is really from all these comorbidities that, cause the dementia to develop. So straight away, Doc, would you recommend soft gel capsules or tablets for her?
Definitely.
That was my gut feel also. So for Ms. Rose, since I do have a interest in dementia, please keep your mom progress. Once you use our soft gel capsules and tablets, please keep your mom's progress. I'll especially tell Sheila or Jhen to look out for you and follow up with you. All right, and we'll see if there's good progress with your mom. Perhaps there are some things that we can do together to be able to help more patients with this issue. Like I said, like cancer, these illnesses have a tremendous toll on the whole family because they are not short. It can last a long time, and it can be very, very demanding and tiring for the caregiver. So if there's any way we can find some progress, let's do that. All right. So yeah.
Thank you, sir. This is actually a call out, no, to all our metabolic illness patients who doesn't see their cases as urgent, no.
Yeah,
Uh,
that's right.
it's best to fix it right now while it's still just diabetes and hypertension. Right?
Absolutely.
Thank you, Sir Sean. Thank you, Dr. Jansen. Another question coming from Ms. Minda Banella. Can PPARS and Cleansing Plus and tablets help to treat sciatica?
No. Why? Because sciatica is an anatomic problem. So sciatica, how does it happen? Um, Sciatica comes from the term sciatic. What is sciatic? That is your sciatic nerve. Okay? So sciatica comes from the sciatic nerve getting compressed, getting impinged on. Okay? So how does it get impinged on? It's usually a compression of your spine. It can also be from muscle spasm.
Mm.
So you have to address these issues. Okay, to address to really treat sciatica. Okay.
So,
However, of course, yeah.
so would acupuncture even help because you were talking about spasm?
Acupuncture is a
Yeah.
better choice.
There you go.
Acupuncture, physical therapy. Yeah, those are the two. Then if still these two doesn't improve the sciatica, then surgery has to be considered. Actually, even ozone therapy, prolozone, can also help manage the pain from sciatica. But of course, the acupuncture, the prolozone therapy, your vitamins, your physical therapy would only help manage the pain. It will not address the root cause. Okay, so to address the root cause, it's surgery. But of course, not everybody would be a candidate for surgery. Okay, so you need the surgeon to assess you to know for sure if you really need surgery or not.
Doc, by the way, the question about the one about dementia is actually the person who asked. I think the caregiver who asked is actually your patient. So she gave a shout out to you. Yeah, so wonderful. Thank you, Rose. So Rose, since you're already Doc Johnson's patient, so we could probably also have either Beth or I'm not sure if Beth is the one who's supporting you to look out for that. Okay, but I feel for you. That's honestly one of the greatest fears most working adults have with aging parents, right? Is really these three: dementia, Parkinson's, and Alzheimer's. It's like a very scary thing to happen. Cancer is when it happens to you, but this is so peace be with you, and the Lord give you strength. Amen. Yeah.
And I just want to say, for those of you who wish to have a consult with Dr. Jansen Kalalan, you can just simply type in how to consult. Our PTHCS, Miss Beth and Miss Irish will definitely get in touch with you right away. Thank you. For our next question, this is interesting, coming from our viewer, thrown to us privately, Miss Jade. What role do hormones play in breast cancer development? Can my PCOS contribute in developing it?
Yeah, hormones so breast cancer has different types, no. So one breast cancer type is luminal A type. So that would be estrogen receptor positive, progesterone receptor positive, no. So if you are positive with these, it means that the breast tumor can grow because of too much estrogen. Okay, so estrogen can stimulate the growth of the cancer. Okay, so this is hormone receptor sensitive or hormone receptor positive breast cancer. So in PCOS, usually we do see a hormonal imbalance, but PCOS per se, let me take a look at the literature. If how much does PCOS can increase risk of breast cancer? Now, the treatment for PCOS is oral contraceptive pills. The oral contraceptive pills can increase risk of breast cancer later on. Okay, so this is one of the side effects, significant side effects. But PCOS itself, let me just check.
I think we could also align the concerns with myomas for our women out there.
You know, yeah, tonight's
let me see.
discussion
Let
is
me see.
very good. We are very interactive. It's almost as if the viewers are also medical students, and we're having a school project. That this discussion is very lively, and yeah, really enjoying myself today.
It
And
is
I
true to its word that AMA asked me anything, right?
yes, Doc.
Yeah. Yes. PCOS can it can. Now, for PCOS, if you have very high amounts of estrogen, then yeah, having high amounts of estrogen in the setting of breast hormone receptor positive breast cancer, then yeah, it can increase the worsening of the breast cancer actually. On top of this, in PCOS patients, you have also insulin resistance. So the insulin resistance will lead to very high insulin levels, and the very high insulin levels will contribute to diabetes and increased risk of breast cancer. Why are we very much concerned with very high insulin levels? It's because insulin is a hormone that forms things. It's an anabolic hormone. So in metabolism, it can go two ways, no? Metabolism can help break down fuel. It can help. It can break down molecules. Metabolism can also help bring molecules together, so to form more complex molecules or bigger molecules. So in this sense, insulin is an anabolic hormone. So it is a hormone that will help build things and make things grow. Okay, that's why patients who are on insulin, they tend to be on the heavy side, obesity. So going into obesity itself increases risk of a lot of cancer, different cancers, cancer in general. So that's another factor to consider. And on top of that, because you have obesity, you have insulin resistance, chronic inflammation will go up. And chronic inflammation also leads to DNA damage, which will further increase the risk of developing cancer. And mind you, cancer cells love inflammation. They usually grow in areas of the body where there is very high amounts of inflammation. Okay, so yeah, this is the things that we can research articles. Okay, yeah.
Thank you, Dr. Johnson. Sir Sean, would you like to add anything?
No, Doc, it's good. It's good.
Privately, can I take PPARS even if I'm currently taking anastrozole, and how to take PPARS?
Yeah, it's okay to mix anastrozole and PPARS together. You can take them both at the same time, but I would space them out if I were you. Um, the protocol would depend on the stage. At what journey, at what stage of the cancer journey are you? A liquid, powder, soft gels, tablets. Usually I prescribe a combination of both. But if the cancer is still there, you haven't had surgery yet, it's almost always the liquid. Okay.
Thank you, sir. Thank you, Dr. Jansen. Next question coming from Mr. Clarkson. Can breast cancer recur after treatment, and how is this monitored?
Yeah, it can still recur even after completing treatment. Factors why it recurs involves lifestyle factors, genetic factors as well, and yeah, lifestyle factors mainly. Yeah, and whether or not you're obese or you have a normal weight. So again, obesity can influence the growth, the progression, and the recurrence of cancer. So everything will just go up. Okay. Yeah. That's the issue. Can you repeat the question again? I was lost in my thought.
No problem. The question is, can breast cancer recur after treatment, and how is it monitored?
Yeah, so the next question, how is it monitored? So to monitor recurrence, we use PET CT scan. PET CT. Why do we go for a PET CT scan? Because we want to know if small or very minute nodules are metabolically active or not. Because if we just go for a CT scan, with this is even with contrast, okay? Very small tumors might not form blood vessels, so the contrast might not go in there. And very small nodules, we do not know if it's benign or malignant. Okay, and checking it's checking the metabolic activity of a nodule would make sense because cancer is highly metabolic. Cancer cells love sugar, no? And in the PET CT scan procedure, they give you a sugar water, the juice that is tagged with a radioactive tracer. So even small nodules, if it becomes metabolically avid, no, or if it is FDG avid nodule, so meaning it's metabolic, it's highly metabolic, it's metabolically active, then the suspicion of it being a recurrence is high. So that's one way to monitor. Okay, so this is when we use different imaging modalities together. There's another way. Okay, another way is to check circulating tumor cells. So this is liquid biopsy in a more common term, no? So in liquid biopsy, we get a sample of your blood. We check circulating tumor cells. No, so every single one of us have cancer cells circulating around our body. It's just that healthy people don't form tumors because our immune system can fight them off, can kill the cancer cells. But for patients who are after you finish your treatment, then there's this worry, okay, do I stop my treatment already or do I need to? And if it is high, we do genetic analysis on these individual tumor cells, then match them to the primary. So if it is breast cancer, check if these circulating tumor cells are breast cancer cells, no? Check if they genetically match. Then that's if the circulating tumor cells are high, then that's the time we have to chase it. Okay, find out where the node, where the nidus is. Okay, then of course better have it removed, and of course the decision of continuing on the treatment would make sense. Okay, even if the imaging says there's no residual tumor left, because PET CT scans, okay, the machine can detect very small sizes of tumor. However, the imaging is still interpreted by a human. So the human error can still come in. Okay, humans can still make mistakes. Okay, although the tumor, the nodule is right there on the screen, the doctor reading the scan might not interpret it as cancer, or it might they might miss it completely. Okay, however, a PET CT scan, the sensitivity and specificity is really very, very high. Okay, so the chances of false negative or false positive results are quite small. Yeah.
I just have a question about the scan. So just in case a nodule lights up in the PET CT scan or during the procedure, does that dictate the staging once again of the recurrence, or will the doctor look into the amount of nodules lighting up during the procedure?
Very good question. So the staging will still depend on the location of the tumor or of the mass, no, or the nodule. If distant organs, no, away from the primary tumor are involved, then that would be stage 4. Example, breast cancer patient already had surgery, completely in remission. After 1 year, 2 years, had a PET CT scan, there is a small nodule which lit up on the patient's liver. That would be classified as a stage 4. If if the tumor in the liver is really a breast cancer tumor upon biopsy. Okay, so be careful of interpreting, no, with this. There are nuances around this, no. So doesn't mean that if you're a breast cancer patient, for example, you did everything, you were declared as you are in remission. Number of years you had a PET CT scan, there is a mass at some part of your body. Automatically, you'll be categorized as stage 4? No. Okay, no. They would have to confirm first what this nodule is. Is it breast cancer or is it a different primary? Okay, because although we can have breast cancer going recurring, no, elsewhere in the organ, there are also, you still have organs that can form their own tumors. Okay, so I hope you understood where I'm coming from. So don't immediately panic and declare yourself as, oh no, I'm stage 4 already, I'm gonna die. No, don't, because this might be again a different cancer altogether, and it's just that it was caught early on, so you're still fortunate in that sense. So relax, no, don't panic. Just very important to go see your doctor, and if a biopsy is warranted, then just have it done. Okay.
Thank you, Doc Jansen. Sir Shyan?
Nope,
Sorry.
nope.
Okay, I think this will be our last question for today. For a person with a history of breast cancer in the family, what age should be the best time to start monitoring?
Okay, me, depends. If you had genetic testing, if it's BRCA1, BRCA2 mutation positive, then I would start screening as early as 25 years old. If BRCA1, BRCA2 is negative, then I would start 10 years ahead, 10 years earlier, no, than the age when the breast cancer was first diagnosed on that family member. So example, if one immediate family member was diagnosed with breast cancer at age 45, then I would begin screening at age 35. Okay? That's me. In the medical literature, it's 35 years old regardless. 35. Yeah, but for everybody, it's 45 years old. That's when we begin. Actually, some do it early. At age 40, they begin advised to screen.
I have a question here that's quite big coming from Mr. John Ramirez. Non-curable cancer or controlled? Is it true? Is non-curable? You might want to elaborate the question. Non-curable cancer or controlled? Is it true? I think the question, because we have this ad that says cancer may be curable. I guess it could be part of your parting words also, Dr. Jansen. Can we say that cancer or breast cancer can be cured, or is it curable?
Okay, I heard this from Dr. Jamie Katapia, no? In that if the cancer was caught early on and it was resected completely, then we can actually declare that the patient is cured from cancer. Yeah. But for higher stages, say for example, the cancer has spread already, we say that the patient is in remission. Because if the cancer has spread already, there's really no guarantee that we were able to kill every single one of the cancer cells. There is always a possibility that it will come back. That's why we say that the patient is in remission. But for early stage cancers, say for example stage 0 breast cancer, stage 1, wherein you had a very good you did a very good surgery, then I agree with him that we can actually say that the patient is cured in this sense. No, even the medical literature, you have procedures which are curative in intent. No? So there is this concept in medicine Okay, so depends on what stage the patient is in, actually, whether or not we can consider the case as curable or not, and it also depends on what kind of cancer.
Yeah, so we are into parting words, right? So I think one of the confusion, yeah, I think one of the confusion between doctors and patients is the understanding of the word cure, right? Because doctors are very technical about the word cure, and patients' definition of the word cure can be different from the doctors. What doctors consider remission, patients actually consider cure. It's really different. And Doc, as you were saying this, right? Because we say in remission, because let's say you're free from cancer and then 4 years down the road, the cancer comes back. So if we had said that you were cured of cancer, then it would have been too early because the cancer came back. So we are very technical about the term in the sense that from a doctor's perspective, doctors are very technical about the term by saying that it is in remission. But so it doesn't mean that if you cross the 5-year mark, then you might say that you are, from a layman's term, yeah, you are, you are cured. I'm also thinking, I think I don't know whether doctors will use the term more like a layman when it comes to something more mundane, like a flu, right? You caught a flu that you recovered from, but someone in your family caught it from you, and then later you catch it back. Does it mean that you were cured and then reinfected, or were you in remission? So we
Yeah.
right. Here's that part. So I think to address the gentleman's question, you're basically asking this question, right? Can cancer be defeated in a understanding that is reasonable? That means you can hope that your life can proceed on as normal. You no longer live under the immediate specter of cancer going to kill you, right? You're free from the fear that the cancer is going to kill you, because risk of another type of cancer, not even a remission, right? You develop breast cancer, and then because of, let's say, other issues, you might then develop liver cancer, another bout of separate cancer. So I think from that perspective, if you catch cancer early, especially for a cancer that is so well researched and so well treated with many modalities, like breast cancer, to use a layman term, can you cure early stage breast cancer? Yeah. Can you cure late stage breast cancer? Probably, yeah, but we will wait a few years before we declare you cured. You have to definitely cross the 5-year mark, right? And then the specter of death coming from your cancer is no longer hanging over you. Then I think the definition between a lay person, a normal person, and a doctor is already not much different, right? Because in essence, how you live your life is as if you're cured. So if you're living your life as if you're cured, then basically there's not much difference in the definition anymore. So I think so the answer is a positive yes lah. Because for breast cancer in the early stages is a positive yes. You can look forward and hope for that solution, that you no longer live in fear of cancer for the rest of your life, right? But it does mean that you take better care of yourself and be aware that you are a cancer survivor, and there are things you should take extra care compared to a normal person. So with that, I just want to thank everybody and Dr. Jansen also. I actually felt today's session for the AMA is like rather interactive thing. I actually did enjoy myself. I was actually very tired coming into, actually energized by the many topics, including these are all wonderful. Yeah. Thank you, everyone. Yeah, Sheila. Thank you, Doc.
Yeah,
Thank you.
thank you, everyone. Yeah.
On behalf of our viewers, thank you, Sir Shyan and Doc Jansen, for answering our questions once again. Okay, all right. Well, at this point, I just want to share exciting news because you are in for a treat. Catch our ongoing Lazada Sulit Sweldo sale until January 17th. That's tomorrow, Friday. So please hurry and check our participating products. Please remember that we are not only in Lazada, but we are on Laz Mall. So you can be assured that what you are ordering are legit and authentic. Get in touch with us to get the legit Laz Mall link. We also have this another exciting news on top of our ongoing Lazada Sulit Sweldo sale because we have an ongoing promos if you order via direct to from our office and via website. Buy 3 boxes of PPARS liquid extract and receive a free bottle of PPARS tablets to boost your health naturally. This PPARS liquid extract and PPARS powder extracts are perfect for severe conditions such as suspected and active cancer, and even cysts or tumors. But wait, there's more. Because if you buy via website, that's www.simplynature.asia, you can even get an additional savings of 200 peso discount for a single purchase of 1 box of vial, 1 jar of PPARS powder, and the 3 boxes of vials. Now, we also, if you know anybody who has diabetes, hypertension, or metabolic illnesses, I'm sure you're thinking about them. So please manage their health issues with Simply Nature PPARS soft gel capsules because we have this upcoming promo starting this coming Monday, January 20, that if you buy 6 packs of soft gel capsules, you'll actually get a free 1 pack, 3,600 worth of free PPARS for you. There you go. Now, of course, for all these promos are running until January 31 only. So what are you waiting for? Talk to your assigned client service officers and right now to get all this and avail these promos. Now is always the best time to get the best health, not only for yourself, but your whole family. So experience the benefits of PPARS at an unbeatable price. Once again, if you wish to have a consult with Doc Jansen Kalala, type in how to consult or visit his page here in Facebook as well, because our pretty HDS Miss Beth and also Miss Irish will definitely get in touch with you right away. So once again, we hope to see you next Thursday. That's January 23, 7:30 also on a regular Simply Healed webinar entitled Preventive Medicine, How to Stay Ahead of Your Chronic Illnesses. So once again, guys, thank you so much for being with us tonight. Know that your victories over your health battles, most especially cancer, is what keeps us going here in Simply Nature. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.